Hi, my name is Dr. Trudy Hall. I am Region 2 Chairperson of the National Medical Association, and we are here now in Philadelphia at the Downtown Marriott. We've had our conference from April 27th to the 29th, and it has been a wonderful time here talking about healthcare for our community, as well as the health of our physicians coming out of the questionable post-pandemic. I am happy to have joining me today, and who have come today for our conference, is our President of the National Medical Association, Dr. Garfield Clunie. Dr. Clunie, thanks for joining us.
Thank you.
Dr. Clunie, as President of the National Medical Association, just tell us a little bit, what has the year been like? What have you been focusing on? Just really all the good things that you've been doing this year of this presidency.
All right, great. Thank you. It's great to be here. Great to be with you all, even though it's a short time. But wow, being the NMA President is more than I could have ever expected. The opportunities to speak in front of Congress people, to speak in front of communities, to speak in front of other physicians, and advocate for Black physicians and Black patients has just been a phenomenal experience. One of the biggest things that I talk about this year is voting. And the reason why voting, what sort of triggered me off with the voting is after the last national election, there was a lot of issues that occurred with states restricting the right for some to vote, regardless of how you want to look at it. It does, these laws do restrict rights. And as we all know, your health care, your outcomes are tied to your access and your resources that you have within your community. And so I always say we have to take our power to vote very seriously, because voting is directly tied to public health. And you have to vote no matter what side of the aisle you're on, or on both sides of the aisle. You have to vote for people who look out for your best interests and for the interests of your community.
Yes.
Because that's the only way that you're going to improve things. We talk about the social determinants of health a lot, and as we know, access is an issue, but we talk about how certain populations have obesity and different medical issues. But if you don't have safe streets, and you don't have places where you can exercise, or you don't have foods in or stores in your neighborhoods that can give you fresh foods, it makes it very challenging for you to have good health. And so I tie all of this back to voting, because it's very, very important from a resource standpoint. I was interviewed on NBC News a few weeks ago, and they asked about a report that was put out by the CDC regarding the fact that maternal mortality increased across the board, actually during COVID, and why that happened in this resource-rich country. But I said, it depends on where the resources are going.
Exactly.
It really depends. I mean, some elected officials, if they're not interested in a certain cause, they're not going to put money towards that cause. And so you have to take your right to vote, that power that you've been given, very, very seriously.
Yeah, you're exactly right. I say vote for your health.
Yeah,
because
absolutely.
it really, really does matter. The pandemic actually exposed a lot of health inequities in our community. What are we seeing now? And again, we're not out. People are still getting COVID, but again, we're not seeing the level of severity. But what are we seeing now post kind of that pandemic? And what has the pandemic actually heightened our awareness of, or made more aware of the health of people of color?
Yeah, I always say, the essential worker, we didn't know what that was until COVID happened. And essential workers are sometimes folks who have the least resources, the least access, the least amount of money, but they have to show up. If they get sick, they don't get paid. And so COVID taught us that we really have to look at our communities and look at access and assist these communities with getting better access to care. We've heard a lot about community health workers, and as I say, those folks are the ones who saved some of these communities because they were sort of an underground network beforehand. Now it's exposed that what they're doing, but they were helping people get to their care in very creative ways.
Right.
And I think there's a lot of attention now paid towards making sure they're adequately funded and making sure they're adequately supported to do their work. Because I work at a big academic and medical center. I don't want for anything in my institution. They have plenty of money, but I don't know what the community needs. And those community workers help us bridge that need of how to help the people in the community get to the access, get to the care that they need.
Right. Dr. Clunie, tell us a little bit about the National Medical Association. I know a lot of people heard of the American Medical Association.
Yeah.
So what's the importance of this institution I want to call it the club of physicians of color, and what is our agenda?
Yeah. It is a club, and a very exclusive club, but you're all welcome. Everyone's welcome to join, of course. But in all seriousness, it's an organization that's 128 years old, founded in 1895. And, when you look back at the history, and I have to be honest, as the president of the organization, I learned a lot more of the history than I knew before. But if you look at our history back then, as we know, black physicians, black patients, black people just in general were completely disenfranchised and marginalized, some of which is still going on now. But there was one important factor within the medical community that the American Medical Association, which was really the white association, would not allow blacks to join their organization. And the reason why that was so important was because you needed to be a member of the AMA to get certain privileges and certifications to practice medicine. And so if you were excluded from that, you were extremely marginalized, and then the population that you want to treat are also receiving less than optimal care because of the situation back then. Right. And so over the years, we started our own medical schools, our own medical training centers, but then the Flexner Report was released. And it had to do a lot with not the practice of medicine, but a lot to do with money and pharmaceuticals, and not really the standard of medicine. But what it led to was the closure of many hospitals that trained black physicians, leaving only Meharry and Howard left to do that. And again, we think now we have a lack of black physicians to care for black patients. Think about it back then, when there were really very few places that you could train, 2 places in the entire country. And so the National Medical Association, part of our mission, which hasn't changed in 120 years, and we reviewed this probably 10 years ago and said it still stands, is that we support health and wellness in terms of preventative care, supporting and promoting preventative care, eliminating health disparities, which you can translate that into also increasing equity, healthcare equity, but eliminating disparities, trying to educate and promote healthcare and how you can take better care for yourself, but also physician viability is a large arm of what we do. And physician viability means that physicians in medicine, black physicians, they're still sometimes targeted and have a difficult road when they go to many medical institutions. There are very few what we call HBCU, historical black colleges and universities, and also medical centers that are in this country. So most of us are training at white institutions, for lack of a better term, and there are challenges. And so the National Medical Association is here to help all physicians, educate them on best practices, how to navigate the Medicare, Medicaid system, how to navigate building your office, best practices for your patients. We have a large educational component to our organization as well.
Great. How many, what's the percentage of physicians of color, African American physicians in the country?
Unfortunately, it's about 5%, plus or minus, depending on what you read. But the interesting fact about that is back in 1900, it was about 1.6% of the physician population was black. And in, I think there was a landmark study done out of California, I think it was published in 2015 or 16, but it talked about the number being about 5% at that time. But the thing to really realize is that from 1940, when the number actually significantly went up to about 2.6%, to the mid 2015, the number went to 5%. You could say, okay, it almost doubled. But what happened during that time is the number of black male physicians actually went from 2.5% to maybe 2.6%. But black female physicians went from 0.1% to about 2.5%.
Right.
Which is huge. But it stands out, though, that there's something happening with black males as they try to navigate their pathway to medicine. And so the National Medical Association actually is working very hard with the AAMC, which is the Association of American Medical Colleges, with initiatives to help students all the way back from elementary school, to help them navigate the pathway to medicine if that's what they so choose. But also there's a component for it that if you don't have to be a doctor, we need folks in research, we need folks in pharmaceuticals, we need folks in all industries in healthcare to represent us and look out for our best interests. And this is really one of the largest initiatives that I've seen done to assist in that pathway of especially black male physicians going into medicine. The initiative is probably going to be rolled out sometime in June.
Awesome.
We're going to have our first conference in June to roll that out.
Awesome. Talk about our annual conference. It's coming up.
Can't wait. Can't wait. Coming up very quickly.
It's going to be in New Orleans.
It's going to be in New Orleans, a great city. Very excited about that. As president, you get to plan two what we call plenary sessions during the conference, two major sessions that the entire organization attends. And two of my sessions are, one is actually a part 2 from last year, which is Physicians Under Attack, which we're going to talk about the challenges that physicians have as they go through medicine. And actually we're actually including medical students, residents, and attendings, and give solutions. We're coming up with solutions and resources to help everyone navigate their way. Because no matter what career you're in, there's always obstacles that can be in your way. And we're creating resources to help physicians and trainees navigate their way through. And then my other plenary is really the state of health in Black America.
Yeah. Awesome. The dates for the conference is what?
The dates for the conference are July 29th through August 3rd.
Right. And if anyone listening wants to get more information about our organization, how can they get more information?
Our website, nmanet.org. nmanet.org.
Good. So I'm going to finish up with our conference here in Philly. What have you seen? What have you heard? I mean, just what have been your experience joining our Region 2 conference?
Yeah, it's been a great conference so far. Unfortunately, I wasn't able to make it yesterday, but I am here today. And the two things stand out to me for this conference. One is that you have a large contingent of students here participating in the meeting. Mm-hmm. And that goes a long way because you can't be what you can't see. And so they are seeing their future right there, and we are seeing our future coming up, which is really phenomenal. The second part is there's a large part of the attention is paid to wellness.
Yes.
And we know that after COVID, it devastated all of us in many different ways. And many of us had to walk into that hospital every day. And I say to my colleagues, I say we walk into the beast every day.
Yes.
But it's something that we signed up for this. We signed up for it, but it did take a toll on our bodies. And I love that you guys are really giving us information on how we can cope with these stressful feelings that we have post-COVID.
Yeah, I personally ran the COVID hospital for 2 years for the state, so
exactly.
It was very much a long road, and I did see the devastating effect on our physicians. So, but I want to end on a good note. Region 2, National Medical Association, Trudy Hall, your chairperson, here with a fireside chat with Dr. Garfield Clunie, our president of the National Medical Association. Thanks for joining us, and we hope to see you in New Orleans.
That's right. See you in New Orleans.
See you in New Orleans.
Take care.
Good.